What's up, everybody? It's me, Blake McClellan again. Here we go. Today's date is 10/21/2020. This is our Case Connection Unit 2 video that we are required to present. I'm going to be discussing a few case connections that require some research to understand the question, answer the questions, and things like that. So this is for the course Medical Biochemistry. And we are taking this at the University of New England online course. And I do have a script handy, so if you see me looking around off the camera a little bit, I'm trying to follow the script, so let me adjust that some. So, all right, well, we'll get into this. What I chose to do on the case connections were question 3 and question 4. So we'll start with question 3. Looks like we have a 5-year-old boy presented to his local pediatrician for his annual checkup. And there, I'm sure the pediatrician had asked, has you noticed anything different, anything abnormal to the mom about the child? So she said that she noticed the patient is often sickly. She notices that he has been drowsy as well, with polyuria, polydipsia. And if we're thinking back, we know that these are sort of the signs and symptoms of hyperglycemia. So I'm sure this had the pediatrician concerned, wanted him to run a few tests. So they got some blood work, and they also did something called the glucose loading test. Our chart here on case 3 provided us with some information. We'll get to that just shortly, but in order to understand more fully this case, we would have to understand what the glucose loading test is. So basically, the glucose loading test, or otherwise known as the glucose tolerance test, measures the body's response to ingesting dietary glucose. So we have, the data table shows that serum insulin levels were drawn before in the fasted state, and also 1 hour into the glucose load, which would then be in the fed state. So it looks like during the fasted state, this patient's serum insulin levels were 0.8. So this is kind of an expected response. If we look back to our notes here, our wonderful study guide, it shows that in the fasted state, insulin levels would be low. And here, 0.8 is on the low side. And we'd also see that glucagon, cortisol, and epinephrine would all be elevated. So we fast forward a bit, as 1 hour passes into the glucose load. They give the patient some, and his serum insulin levels increase to 5. So 0.8 to 5 increase is adequate. So I had some hard time trying to find the normal range of values, especially for the pediatric patients. But we do know that this is an increase, so it would be an expected response at the biochemistry level. So, and also during the fed state, we'll see that the insulin levels would elevate, as we were just talking about. And so what happens to the glucagon, cortisol, and epinephrine? All those drop. So we have sort of the vice versa change from the fed to the fasted state, etc. So we had to answer a couple of questions here in further detail. So would we expect this child's fasting blood glucose to be within a normal limit, to be elevated, to be below average? So what I chose was, I expect his fasting glucose level to be okay, to be within the normal range, because we have this expected response in his serum insulin levels before and after this test has been underway. So it seems like all of his metabolic processes and everything that we have really looked into, that we have been studying on, they all look good. They all look like, so far so good. So he may need some further testing soon or in the future to determine what has him really thirsty, really hungry, go in the bathroom a lot. So, but for now, this test seems to be in order. And we also have to list 2 regulatory enzymes that are likely to be active in this patient's current condition. So since he is in the fed state, we've had this process, we've seen it unfold, I would anticipate that P13 kinase and phosphoinositol kinase 1 or PDK1, as I would abbreviate that. I think those two would be active, and I think that would answer our question. So moving right along here to question 4. Here we're presented with a 2-month-old female. Parent says that kind of been having some jitteriness, restlessness, especially after breastfeeding. And the lab values that they drawn indicate some hypoglycemia. So at the clinic, they had also administered epinephrine, and there was no increase in blood glucose, though there was an increase in blood lactate. So that's something to keep in mind as well. So upon physical examination, palpation, notice that the liver is enlarged, or hepatomegaly is identified. And after feeding, the blood glucose levels increase slightly, but are unable to remain stable throughout the course there. So based on this data, we're presented with 4 options, A through D. A would be hereditary fructose intolerance, B is galactosemia, C is glycogen storage disease, and D is glucose 6-phosphate dehydrogenase deficiency. And we had to pick between those 4 and really break it down. So I'm just going to get right into it and answer the question to my best ability. A lot of these answers are very, very similar. But based on this data, we can predict that the patient is suffering from glycogen storage disease, which is option C. And this is a rare condition that changes the way the body uses and stores glycogen. We also know that glycogen is stored in the liver and is a major source of energy for the body. And the glycogen under normal conditions is broken down via glucose 6-phosphatase and converted into free glucose. So during glycogen storage disease, the body is lacking the enzyme glucose 6-phosphatase, and there is a disruption in the process causing hepatomegaly, which we were offered in the case, hypoglycemia, jitteriness, acidosis, which we found that for the increase in blood lactate levels. And we also kind of touched on this disease for week 6 lectures. It was von Geert disease. So I also did my pathway response on that too. So it kind of made it a little easier for me to understand. So we also have to talk about why the other answers are incorrect. So we'll get into that as well. So referring to our notes, we know that we can eliminate a few options. First, glucose 6-phosphate dehydrogenase deficiency. Now this one also lacks that glucose 6-phosphatase that we see in our answer choice. However, this disorder also indicates hemolysis, jaundice, hemolytic anemia. And if we go back to the question itself, when they got some lab values, they only determined hypoglycemia, but were otherwise unremarkable. So we have to keep that in mind. And with that being said, we're going to eliminate that choice. We can also eliminate galactosemia, which would be a popular option following class discussions and pathway response problems. Everyone was wanting to talk about that one. Very interesting topic, by the way. But we've learned that these infants are typically identified earlier in life, primarily a couple of days after birth. You'll see that they'll start having some major issues. They would be unable to really metabolize lactose. So this would also lead to hepatomegaly, vomiting, jaundice, diarrhea, lethargy, and in worst cases, liver failure. So we can discuss and further that at another time. But the treatment for that would be different feeding options for the infant. So I think we can eliminate that just based off the age of the child and the severity of the other illnesses that it encompasses. So lastly, hereditary fructose intolerance. I think this can be eliminated as well. This disorder will also cause hepatomegaly and fasting hypoglycemia, but this disorder does not cause an increase in blood lactate, which we saw that when they administered the epinephrine. So with this disorder as well, you may also see convulsions, failure to thrive, irritability, vomiting, jaundice, and all of this is occurring after fructose ingestion. This condition is due to the body's inability to break down fructose due to the lacking aldolase B protein. Kind of hard to say, but we learned about that as well. So I thank you for listening in to my spiel. and answering these case connection questions. So I'll get them uploaded. Hope you all enjoyed and maybe learned something. So thank you very much.